What ancient scar remedies did cultures use? Imagine a time long before modern medicine, when people relied on natural resources and cultural rituals to care for wounds and scars. Ancient cultures had a fascinating array of methods aimed mostly at easing pain and preventing infection, rather than focusing on cosmetic appearance. These practices were deeply rooted in their beliefs, environment, and social customs, and some even influenced modern wound care principles. One of the most well-known remedies is honey. Ancient Egyptians used honey extensively on wounds because they recognized its natural antibacterial properties. They applied honey to cuts and burns to help prevent infection and promote healing. Modern science supports this, showing honey's ability to inhibit bacteria and keep wounds moist, which aids recovery. Honey's use in wound care has persisted through centuries because of these proven properties. Plant extracts also played a significant role. The Greeks and Romans used aloe vera and various herbal remedies on their skin. Aloe vera, in particular, was valued for its soothing effects and ability to reduce irritation. While these treatments mainly aimed to relieving symptoms like pain or itching, they also supported the natural healing process. Many herbal remedies used historically are still appreciated today for their gentle, supportive effects on skin. Ancient Egyptians were skilled in wound dressing techniques. They used materials like lint to absorb fluids and applied greases or oils to create a protective barrier over the wound. This helped control infection and kept the wound environment optimal for healing. Proper bandaging was crucial in preventing further injury and supporting tissue repair. In some cultures, especially in Africa and among Australian Aboriginal groups, scarification was a common practice. This involved controlled cutting or branding of the skin to create decorative or symbolic scars. These scars were often arranged in patterns and held cultural significance, representing rites of passage or social status. Interestingly, some techniques involved rubbing wounds with substances like clay or ash to influence how scars formed, sometimes encouraging raised scars or keloids as part of their aesthetic or cultural expression. Scraping therapy was another interesting method. The ancient Greeks used a tool called a strigil to scrape the skin after applying olive oil. This process might have stimulated blood flow and immune responses, helping to promote healing and reduce discomfort. It was a physical way to support the body's natural recovery processes. Many ancient cultures also combined physical treatments with spiritual rituals. They believed that healing involved both the body and the spirit. For example, the Sumerians used incantations alongside poultices, reflecting a holistic approach to wound care that aimed to address both physical and spiritual causes of injury. From a modern perspective, these ancient remedies highlight early awareness of key principles like infection control, moisture balance, and immune response. While ancient practices often accepted scars as part of life or cultural identity, today's plastic surgery focuses on minimizing scars and improving appearance through evidence-based techniques such as silicone gels, laser treatments, and surgical revisions. Some natural substances like honey and aloe vera have been validated for their healing properties, but modern scar management is guided by scientific research and personalized care. In summary, ancient cultures used a mix of natural materials, physical manipulation, and spiritual rituals to care for wounds and scars. Their focus was on symptom relief and social meaning, rather than cosmetic perfection. These historical practices laid the groundwork for today's advanced methods, reminding us of the importance of infection prevention, moisture, and immune support in healing. If you're considering scar management today, always consult with a qualified healthcare professional to find the best approach for your individual needs.